One of my grandfather's sayings he lived by was, it's the difference you make, not the dollars you make. That's always been part of who we are, my brothers, my mom, my family.
I've never met anybody who's as kind and smart as Mark.
I first met Mark McClellan when he was commissioner of the FDA.
His career has played such an integral role into shaping my career.
Mark makes things happen. He is brilliant, he's kind, he's smart, and he's maddening.
And Mark's always been a leader in health policy that I've respected and admired. So the opportunity to bring Mark to Duke was just an opportunity too important to miss.
I've been fortunate to witness Mark's incredible career over the past 30 years.
It was a real privilege for me to have a chance to work in the White House and FDA and CMS, and then staying involved in policy since then. Janet Woodcock really helped put together for us at the time was what we called the FDA Critical Path Initiative.
Mark initially asked me, he said, well, we have all this great science, but maybe nobody will be able to afford the treatments. So I collaborated with him on getting out reports on this huge gap in our ecosystem. And that has continued to this day with the formation of the Critical Path Institute.
Mark's always been a thought partner and very willing to share the lessons he learned as he did things like Medicare Part D reform.
Mark was involved in actually building and structuring that program. And then together we implemented it. We brought a new public benefit to 43 million people together.
I have worked with Mark for many, many, many years. He never lets up.
He is still a doctor, a clinician, and a health economist at his heart.
What I really love about Mark is he's not ideological whatsoever. He's so pragmatic.
He always gave me a perspective which was useful as I thought about my own priorities.
I'm deeply thankful for all the time and collaboration he has given us over these many years.
Well, the Duke Margolis Center that Mark leads is really a treasure for the U.S. It takes on some of the toughest issues in the U.S. healthcare system.
After leaving government, spending some time in the policy world, I really thought what was needed was a closer connection between academic researchers and the political and policy environment in Washington, D.C.
Once he gets started down the policy road, he is just energized, and that is an infectious energy that he brings to faculty and students.
There really is a perfect partnership between Bob Margolis and Mark McClellan. And you can see Bob's vision of how we have a health policy institute that shapes policy and also leads the way for the entire nation.
I'm also a cancer survivor. I got to say there's a long way to go, but we've made amazing progress.
Thanks to people like Marlene, Malek, and Ellen Siegel and friends, as well as thanks to people like Bob, to make a big difference in getting to better health care for Americans.
There is a clear handshake point between Friends of Cancer Research, Mark McClellan, and the Duke Margolis Institute.
Dr. McClellan really helped give Friends of Cancer Research initial footing in how to effectively advance health policy.
I think there are few Americans in this century who have affected public health more than Mark.
Mark is a true policy wonk.
Mark's a singular person. You know, you could call him an academic and you'd be right. You could call him a government person, you'd be right. You could call him a private sector person and you'd be right. He's all those things.
Marlene's commitment to public service has, at times, been quiet support for others in public service as well. That's Mark McClellan. He's not in it for the spotlight, but motivated by how he can make healthcare better for people.
For Mark, like me, family and service is my guiding light. He continued his family's long history of service, and he has influenced those around him to follow the same path.
My mother was mayor of Austin, so public service has kind of always been in the family background.
Mark, at his core, believes in better care for all.
There's still a lot of work left to do, but he's helped move this gigantic system in the right direction, and I think he will continue to do so for the foreseeable future.
Mark, it's been such a privilege to work with you over the years. We've really had a very fruitful partnership, which I think is continuing in some of the initiatives we're working on now.
Thank you for what you do to make all of our lives better every day. And on a very personal level, thank you for teaching me how to navigate this landscape.
We've worked together shoulder to shoulder on projects that mattered, and doing it with you has been an enormous part of the joy I have gained from public service.
From my heart, Mark, you've been an inspirational leader, a friend and a colleague, and I've learned so much from you.
Thank you, Mark, for all that you do for Duke as well as for our patients.
At a time when we have so many divisions in our country, you're one of the few people who can bring those divisions together.
Congratulations, Mark.
I'm truly honored to be giving you this award. Your contributions to our country have been truly profound.